Good afternoon, everybody, and thank you for having me for this session. As we know, cancer treatment is a multidisciplinary treatment with surgery, chemotherapy, and radiotherapy. However, since 80% of the cancer patients in India present at an advanced stage, palliative care should be integrated into active cancer care and not reserved for end-of-life care only. Palliative care and pain. Can you hear me? Sorry, can you hear me?
Yes, ma'am, we can hear you. Yes.
Can you hear me?
Yes, ma'am. Yes.
Okay, sorry. So palliative care and pain management have largely been ignored because the measures of health outcome have been cure and extension of life. Caregiving interventions that alleviate pain and severe health-related suffering and increase the dignity at the end of life, which are the essential features of palliative care, have been grossly neglected. Also, cancer does not affect an individual, but the entire family. And support to caregivers and communication are also important aspects of palliative care. So we would, can I have the next slide, please? So in this panel, we've got Dr. Navin. The other two panelists are also there. Can I have Dr. Navin?
Yes, ma'am.
Dr. Jayarajan?
Yes, I'm here.
And Dr. Prakash Fernandes.
Yeah, good afternoon.
Dr. Navin is from KIMS Manipal. Dr. Jayarajan is the palliative care consultant at PD Hinduja Hospital, Mumbai. And Dr. Prakash Fernandes is the head palliative partnership, Cipla Foundation, Mumbai. The points we would like to discuss is palliative care services in India. What are the ground realities? What are the challenges in its implementation? Where are we now and how can we improve it? Can I have the next slide, please? So I think this question I would like to, is the third panelist there? Is there?
Yes, Dr. Patel.
Dr. Fernandes. So I would like to address this to you as to what percentage of cancer patients in India require palliative care and how many have access to it.
Yeah, thank you, Dr. Firuza, for that question. And I think it's really good to begin this because it really depends on how we look at palliative care and our definition of the scope of palliative care. And I think if we look at two aspects of palliative care, one is that palliative care is focused on how the disease is impacting the individual, on their pain, on their symptoms, how they're dealing with this diagnosis that they've just received, how it's impacting them spiritually, financially, and the caregiver. So that's one aspect of palliative care. The second, if we look at palliative care as looking ahead and preparing the patient and family for what's going to happen, perhaps, the changes that they need in their diet, the physiotherapy, the kind of precautions they can take as their symptoms go on. So preparing them for that journey.